thoracic pain with radiating pain, or thoracic outlet syndrome. The associated impairments for this condition include non-optimal postures that allow the muscles to adaptively shorten and potentially compress on the neurovascular bundle. The differential for this condition includes clearing the joints of the cervical and thoracic spine. Here you see a negative Sperling's test, indicating that the entrapment site is not at the neuroforamina. You may have mixed findings with cervical palpation, negative findings with overpressures and full range of motion of the glenohumeral joint, indicating that this is not the source of the patient's symptoms, negative findings with the Phalen's test, ruling out carpal tunnel syndrome, and negative findings with the Finkelstein's test, ruling out the extensor pollicis brevis and abductor pollicis longus as the source of the patient's wrist and hand symptomology. There may be negative findings with palpation to medial and lateral epicondyle of the elbow, ruling out this common source of elbow and forearm pain. The interventions for this condition always begins with patient education and counseling. Help the patient to understand that the positions that they assume for their work and for their leisure may contribute to the maintenance and persistence of the symptoms. The education should also include optimizing the patient's postures and creating an awareness of their body in space. If the patient demonstrates abnormal breathing patterns, train them in diaphragmatic breathing so that they do not overuse their accessory muscles like the scalenes. If you note scapular positional faults, a correction of the faults and strengthening of the associated muscles is indicated. Spinal mobilization and manipulation to improve the thoracic mobility and help to modulate the patient's symptoms. Restoration of upper quarter muscle length and strength impairments. Here we are strengthening the middle and lower trapezius muscles. This is indicated if there is weakness found upon testing. Pectoralis major and minor elongation. Here there is soft tissue mobilization being applied to the pectoralis minor. This may be relevant in the case where there is a positive hyperabduction test. Normalizing the tone and length of the suboccipital extensors, which will help the patient to assume a better posture. Educate the patient about optimal breast support wear. Have the straps of the bra closer to the neck and not on the distal edges of the shoulder. If there is an elevated first rib, then mobilizations like this first rib inferior glide are indicated. Once you have reduced the entrapments, upper quarter nerve mobilizations are indicated. Here you note the patient is doing a slider type technique to help improve the health and mobility of the nervous system.